Introducing the Pulset ABG syringe with safety tip device by AirLife. With special features and various safety advantages, the Pulset ABG is one of the easiest and quickest syringes to use in healthcare today. The vented plunger design allows for air to pass through the filter, eliminates the need for a vented tip cap, and reduces the steps for expelling air from the syringe. The integrated vented plunger protects healthcare workers from blood exposure. The entire inside of the barrel of the syringe is lined with dry balanced lithium zinc heparin, which easily mixes with blood to prevent clotting and eliminates errors on ionized calcium results. Our syringes contain 25 units of dry balanced lithium zinc heparin. This balanced blend truly equalizes the electrolytes by binding zinc with lithium, preventing lithium from binding with calcium in the blood. Regardless of the electrolyte reading, when blended at a 1-to-1 ratio, the result is always balanced. Thin-walled needle technology utilizes the same inner needle diameter and maintains the same flow characteristics and fill time as standard needles while utilizing a smaller outer diameter. This results in a smaller puncture without sacrificing sampler performance. The Sharps protection device, or safety tip, has a 2-point dual locking mechanism that folds along the syringe and locks with 2 audible clicks. The safety tip is aligned with the bevel up position. This keeps the safety tip out of the provider's field of view. The safety tip is easy to use one-handed. To perform ABG sampling, you will need the safety tip device, alcohol wipe, gauze, and a bandage. Before performing the arterial draw, check the patient's identity. Check for adequate circulation by performing a modified Allen test and locate the radial artery. Using your index or middle fingers, identify an artery path. Prep the skin with alcohol. Let it dry. Grasp the needle and safety tip at the hub and turn the needle a quarter turn in a clockwise direction to ensure it is securely attached to the syringe. When using the Pulset syringe, preset the plunger to desired volume for the sample. Unsheath the needle with safety tip and bevel in the upright position. Then insert the needle into the artery with the bevel up and the syringe at a 45-degree angle. The syringe will begin filling and pushing air out of the sample through the vented plunger until the preset volume is reached. Once volume is reached, remove needle from the artery and immediately apply pressure to the puncture site. Hold pressure for 5 minutes or until bleeding has stopped. Using one hand, keeping the needle and syringe pointing in a downward position, push the safety tip Sharps protection device away from the plunger with your finger towards the needle. Then engage the safety tip by placing it against a hard surface and snapping the needle into the safety tip. When activating the safety tip, you will hear 2 audible clicks, which indicates the tip of the needle and the hub have fully engaged the dual locking system. While still holding pressure on the puncture site, remove the activated safety tip from the syringe and cap the syringe. If there is any air remaining in the syringe, point the capped syringe down and apply light pressure to the plunger. This expels any remaining air and seals the internal filter. If air is not expelled quickly, the filter will seal shortly after becoming wet with blood. Rotate the syringe for 20 to 30 seconds between finger and thumb to make sure the heparin is mixed in the sample. Discard the safety tip into a Sharps container, label the syringe with the appropriate information, and send it to the lab for testing.